Imagine you're out, maybe exploring the Pacific Northwest, beautiful rivers, coastline, with your dog. And, your dog does what dogs do, sniffs around, finds a bit of leftover raw fish, maybe dropped by someone fishing or just washed up.
Right. Happens all the time.
Yeah, exactly. And then maybe 5, 7 days later, your dog is just suddenly terrifyingly sick. High fever, vomiting, really bad diarrhea, maybe bloody. It's a scary situation. What's going on? What do you need to know, like, right now?
That scenario, that sudden severe illness after potential raw fish exposure in that area,
Huh.
it really points towards something specific. Canine salmon poisoning disease.
SPD.
SPD. Okay. The name gives you a hint, but it sounds like there's a lot more to it.
Oh, definitely. It barely scratches the surface.
So today we're doing a deep dive. We've got clinical info, vet guides, research.
Fecal?
We're going to dig into this. What exactly is it? Where does it come from? What does it do to the dog? And crucially, how do you prevent it? How do you treat it? And it's just a fascinating biological story too, isn't it? You've got this tiny bacterium hitching a ride inside a fluke, a flatworm,
Okay.
which needs a very specific snail to live part of its life, which then gets into fish and then becomes a danger to dogs, but only really in this one strip of the world.
Wow. Okay, let's unpack that. Start with the basics. What actually is canine salmon poisoning disease at its core?
So fundamentally, it's an infection. It's caused by a bacterium called Neorickettsia helminthoeca.
Neorickettsia.
Okay, and this is what they call an obligate intracellular pathogen. Fancy term. But it basically means this bug has to live inside the cells of another creature to survive and multiply. It can't just live out in the open.
In inside cells. Got it. But how does it get into the dog cells? It's not just floating around, right?
No, not at all. And here's where that fluke comes in. The rickettsial, this bacterium, lives inside a specific type of flatworm, a fluke named Nanophyetus salmincola.
Nanophyetus.
Okay.
Yeah, so the fluke is the carrier.
Exactly. The fluke is the vector. Dogs get infected when they eat raw or undercooked fish, typically salmon or trout from that specific region, but other fish too that are infected with the fluke larvae, which are carrying the Neorickettsia.
Ah, okay. So the dog eats the fish has the fluke larva,
Yep, called metasocariae. They're in little cysts in the fish's tissues.
and when the dog digests the fish, these cysts break open.
Precisely. They break open in the dog's small intestine, and that releases the Neorickettsia bacteria that were inside the fluke larvae.
And that's the moment the real trouble starts for the dog.
That's the trigger.
Hmm.
These bacteria then invade the dog's own cells. They target cells in the lining of the intestine and also immune cells like monocytes and macrophages, which travel throughout the body. And when they invade and multiply, that causes this really sudden, really severe systemic illness.
And you said it's dangerous. How dangerous?
Extremely. The sources are clear. If it's not treated, the mortality rate can be as high as 90%. 90.
Wow. That's it. That's incredibly high. It really is a veterinary emergency then.
Absolutely. Urgent care is critical.
Okay. Who gets it? Is it just certain dogs?
Primarily, it's our domestic dogs. Wild relatives like foxes, coyotes, wolves, even bears can get sick. Interestingly, cats. Cats seem pretty resistant. They don't really get the clinical disease.
Huh. Any specific breeds or ages?
Not really in terms of susceptibility. Any aged dog can get it. The average seems to be around 3 years old, but that's just an average. Any breed, male, female. Now, the sources do mention that intact males and maybe Labrador retrievers are seen more often.
Oh, why's that?
It's probably not that they're more susceptible biologically. It's likely more about lifestyle. Maybe labs are more popular with people who fish or spend time near rivers where exposure happens. Same for intact males. Maybe they roam a bit more. It's likely an exposure thing, not an inherent risk difference.
That makes sense. Okay, so we have this specific bacterium carried by a specific fluke in specific fish, but only in a specific place. You mentioned the salmon poisoning belt. Where exactly is that?
Yeah, this is one of the most striking things about SPD. It's almost entirely restricted to the coastal areas of Northern California, Oregon, Washington State, and up into southern British Columbia.
Just that narrow strip. Why? What keeps it contained there?
And this is where it gets even more specific, believe it or not. It comes down to another required player in this whole drama. A particular type of freshwater snail, Oxytrimasalicula.
A snail. The snail is the key.
The snail is the key intermediate host for the fluke. This specific snail only lives in the freshwater streams and rivers within that defined geographic coastal zone.
So no snail, no fluke life cycle.
Exactly. The fluke needs this specific snail for part of its development. If the snail isn't there, the fluke can't complete its cycle in the water. which means it can't develop into the stage that infects the fish.
Which means the fish don't carry the fluke carrying the bacteria.
Correct. So the whole transmission chain breaks down outside the snail's very limited range. It's a remarkable ecological lock.
Amazing. So the biggest risk factor really just boils down to being a dog in that specific area and eating raw fish from there.
That's pretty much it. Living there, or even just traveling through, and having any history of eating raw or undercooked fish, salmon, trout, steelhead, potentially others from those waters, that's the primary risk.
Does it have to be fish caught right out of the river?
Not necessarily. The sources mention cases linked to, like, commercially bought fish that originated from the endemic area, or even dogs getting into raw fish scraps, fish guts left behind. There are even some very rare reports of dogs possibly getting infected just from swimming in contaminated water without definitely eating fish, though that's less understood.
Okay. This life cycle, it sounds really intricate. You said it's like a multi-species relay race. Can we walk through that step by step? How does it actually work?
Sure, let's trace the journey. It all starts when an infected dog, or coyote, fox, whatever, sheds the fluke eggs, the Nanophyetus salmincola eggs, in its feces. And those feces have to end up in fresh water within that specific geographic zone.
Right, back into the water where the snail lives.
Exactly. In the water, the egg hatches into a microscopic larva called a Neorickettsia. This little guy swims around, and its mission is to find and infect that specific snail, Trematode. It has to find that snail.
Okay, finds the snail, then what?
Inside the snail, the fluke transforms and multiplies like crazy. You go through different stages, sporocysts, then rediae, then finally cercariae. These cercariae are another type of free-swimming larva.
And these leave the snail.
Yep, they emerge from the snail back into the water, and now their mission is to find a fish.
The next host.
The next host. They penetrate the skin or gills of a suitable fish again, often salmonids, but other freshwater fish in the area work too. Once inside the fish, they travel to the tissues, like kidneys, muscles, fins, organs, and they form little cysts. These cysts are called metacercariae.
And this is the stage that's dangerous to dogs, containing the bacteria.
Precisely. The metacercaria cyst inside the fish muscle or organs contains the fluke larva, and inside that larva are the Neorickettsia Helminthoeca bacteria,
Waiting for a dog to come along and eat the raw fish.
That's the final step in transmission to the dog. Dog eats the raw, infected fish. Digestion breaks down the fish tissue. Down in the small intestine, those metacercaria cysts get released, and they open up.
And out pop the bacteria.
Out pop the Neorickettsia. They are freed from the fluke larva and immediately start invading the cells of the dog's intestinal wall, and then quickly get into immune cells and spread throughout the body via the lymphatic system and bloodstream. That's what causes the disease.
So just to be crystal clear, the actual illness, the severe sickness, is caused by the bacteria, the Neorickettsia, not really by the fluke worm itself.
That's a critical point the sources emphasize. The fluke matures in the dog's intestine. It lays eggs to continue its own life cycle.
Yeah.
But generally, the fluke itself doesn't cause major illness in the dog. It's the bacterial passenger it delivered that wreaks havoc. The fluke is just the delivery vehicle for the real pathogen.
Fascinating. And scary. Okay, so if a dog gets infected, what does that havoc look like? What signs would an owner actually see?
Well, the first thing is how fast it happens. It's usually very acute, sudden onset. Symptoms typically pop up maybe 5 to 7 days after eating the fish. Could be as short as 3 days or maybe stretch out to 10 days, even 14 in some cases. But usually it's around that 1 week mark. A dog goes from fine to very sick very quickly.
And what are the most common signs you'd see first?
Because those bacteria first hit the intestinal cells, you get really dramatic gut signs. Severe vomiting, profuse diarrhea. The diarrhea is often watery and very frequently contains blood, hemorrhagic. Sometimes it's described as looking like raspberry jam, but it doesn't always look like that. Just bloody diarrhea is common.
Ugh, that sounds awful. And that must lead to other problems quickly.
Oh, yeah. Dehydration happens fast. They usually stop eating entirely, anorexia. But it doesn't stop in the gut. The bacteria spread. They really like to infect the immune cells in the lymph nodes in the spleen.
So those swell up.
Exactly. Significant lymph node enlargement, lymphadenopathy, is a hallmark sign. You might actually be able to feel swollen nodes, especially under the jaw, in front of the shoulders, or behind the knees. The spleen can get enlarged too, splenomegaly.
Okay, so severe GI upset, bloody diarrhea, swollen lymph nodes. What else?
Well, it's a systemic infection, so the whole body reacts. A high fever is almost guaranteed, often really high, like 104 to 107 degrees Fahrenheit, sometimes even higher initially.
Wow.
And with that comes extreme lethargy, weakness, just profound depression. The dog looks and feels miserable. Rapid weight loss is also common, partly from dehydration, partly from not eating.
Are there other, maybe less common signs?
Yes, sometimes. In more advanced or severe cases, you might see neurological issues like the dog seems out of it, maybe has neck pain, muscle twitches, or even seizures, though that's usually late stage. Occasionally, you might see tiny pinpoint bruises, petechiae, or larger bruises, ecchymoses, on the skin or gums, maybe some discharge from the eyes or nose or mouth sores. But really, the classic triad is that sudden high fever, the severe vomiting and bloody diarrhea, and those swollen lymph nodes.
That's a really scary constellation of signs. Okay, diagnosis. Given how fast this hits and how serious it is, figuring it out quickly seems vital. How do vets confirm it's SPD?
You're absolutely right. Speed is crucial. And the most important starting point, honestly, is the history and the location.
Right. Has the dog been in the Pacific Northwest? Could it have eaten raw fish?
Exactly. If a dog presents with those acute signs we just talked about, fever, severe GI upset, lethargy, swollen nodes, and it lives in or has recently visited that specific endemic area, and there's any possibility of raw fish exposure, SPD has to be right at the top of the suspicion list.
So if the dog hasn't been in that region or definitely hasn't eaten raw fish,
Then SPD becomes extremely unlikely. The vet would focus much more on other possibilities, things like parvo, especially in younger dogs, other severe gut infections, hemorrhagic gastroenteritis, HGE, pancreatitis, maybe a toxin, even other tick-borne diseases that can cause fever and low platelets.
makes sense. What tests help nail the diagnosis if SPD is suspected?
Standard blood work helps support the suspicion. A very common finding in about 90% of cases is thrombocytopenia, a low platelet count. Platelets help with clotting.
Okay, low platelets.
You might also see changes in the white blood cell count suggesting severe infection, maybe signs of dehydration or electrolyte problems on the chemistry panel from all the vomiting and diarrhea. Sometimes indicators of liver stress too. But none of these are specific only to SPD.
So they support it but don't prove it. What about imaging? X-rays? Ultrasound?
Imaging can be helpful too. Ultrasound might show those enlarged lymph nodes in the abdomen, maybe in a large spleen that looks a bit mottled or thickened intestinal walls. Again, suggestive of significant inflammation, consistent with SPD, but not definitive proof on its own.
Are there tests that actually find the fluke or the bacteria itself?
Yes, and these are the key ones for confirmation. The traditional gold standard test is looking for the fluke eggs in the dog's feces.
How do they do that?
It involves concentrating the fecal sample, usually through sedimentation or flotation techniques, and then examining it under a microscope. You're looking for the eggs of Nanophyetus salmincola. They're pretty distinct, apparently large, oval, brownish yellow, with a little cap and a poculum on one end. The sources give specific measurements around 6497 nanometers by 3455 meters. Using both methods, sedimentation and flotation gives the best chance of finding them. If they're there, maybe up to 93% sensitivity.
Okay, find the eggs, you've got your answer. Is there a downside to that test?
Yes, a big one. Timing. The adult flukes in the dog's intestine only start shedding eggs about 5 to 7 days after the dog was initially infected by eating the fish.
So if the dog gets sick before day 5,
The fecal test for eggs will be negative even if the dog absolutely has SPD. You can't rule it out based on an early negative fecal.
so what else can be done, especially early on?
Well, if the lymph nodes are noticeably swollen, a vet can perform a fine needle aspirate. Basically, stick a small needle into the node, collect some cells, put them on a microscope slide, stain them, and look closely.
What are they looking for?
They're looking for the Neorickettsia organisms themselves, inside the immune cells,
Mm.
macrophages and monocytes. They appear as little clusters, described as basophilic granular material. Finding those inclusion bodies is considered highly diagnostic. If you see them, it's pretty much confirmed.
That sounds useful. Any other specific tests?
Yes, there's PCR polymerase chain reaction. This test looks for the specific DNA of the Neorickettsia Helminthoeca bacteria
Where can they test for the DNA?
in blood samples, in that lymph node aspirate fluid, or even sometimes in feces. PCR can be really valuable for getting an early diagnosis, potentially before the fluke eggs appear or before those inclusions are easily visible in the nodes.
What about antibody tests? Serology?
They exist, yes. Blood tests can check for antibodies the dog's immune system makes against the rickettsia, but like the fecal egg test, antibodies take time to develop. They might not be detectable in the first few days of illness when you really need the diagnosis. So serology is usually more helpful later, maybe using paired samples taken weeks apart to show a rise in antibody levels. But you wouldn't delay treatment waiting for those results if the suspicion is high.
Okay, so it's really a combination of that crucial history and location, the clinical signs, and then using specific tests like fecal for eggs, lymph node cytology for inclusions, or PCR for DNA to confirm it. Once it is confirmed, or even strongly suspected, treatment needs to start immediately, right? What's involved?
Absolutely. Treatment needs to be aggressive and start fast. It's basically a two-part attack on the cause, plus major support for the dog.
Okay, part one. Attacking the cause. What's the main weapon?
That's the antibiotic to kill the Neorickettsia bacteria. The drug of choice is doxycycline. It's very effective against these types of organisms.
How is it given?
Usually 5 to 10 milligrams per kilogram of the dog's weight, given either by mouth or intravenously, typically every 12 or 24 hours. The course usually lasts for 10 to 14 days and, importantly, should continue for at least 3 to 5 days after all the clinical signs have gone away. Oxytetracycline is another option mentioned, but doxy seems to be the go-to.
Okay, so doxycycline for the bacteria. What about the fluke that brought it in?
Right, you want to get rid of the fluke too. That requires an antiemetics, a dewormer. Praziquantel is very effective against this specific fluke.
How is that given?
Often just a single dose orally around 7.5 milligrams per kilogram. Fenbendazole is another dewormer that works, usually given once a day for 3 days. Killing the flukes clears them out of the intestine, which stops them from potentially releasing more rickettsial and also stops them shedding eggs into the environment.
When do they give the dewormer? At the same time as the antibiotic?
Often, yeah, either concurrently or maybe once the dog is a bit more stable and can reliably take oral medication if they started on IV doxy.
So, antibiotic for the bacteria, dewormer for the fluke, is that it? Just pills?
Oh, definitely not. That's just part of it. Remember how sick these dogs get? The vomiting, the diarrhea, the dehydration. Intensive supportive care is absolutely essential. It's often the difference between life and death.
What does that involve?
Primarily intravenous fluids. Lots of IV fluids to combat the severe dehydration and shock and to correct electrolyte imbalances. They lose a lot of potassium with the diarrhea, which can be dangerous, so that needs careful monitoring and replacement.
Okay, fluids are key. What else?
Anti-nausea medications, antiemetics, are crucial to stop the vomiting so they can start holding down fluids and maybe food. Gastrointestinal protectants, like sucralfate or acid reducers, help soothe the damaged gut lining. If they're not eating for a long time, they might need nutritional support, maybe through a feeding tube. If the bleeding is severe enough to cause bad anemia, a blood transfusion might be needed. And pain medication is important too because they can be very uncomfortable.
Wow. It really is like full-on intensive care for the severe cases.
It absolutely is.
With all that, what's the outlook? What's the prognosis?
Here's the good news, relatively speaking. If, and it's a big if the diagnosis is made early and that aggressive treatment with doxycycline, the dewormer, and all that supportive care is started promptly, the prognosis is actually considered excellent to good.
Really? Even after being so sick?
Yes. One of the striking things the sources mention is how quickly dogs often respond to the doxycycline. You can see significant clinical improvement, sometimes within just 24 to 48 hours of starting the antibiotic.
That must be amazing to see. A huge relief.
It really is. It's a strong indicator you're on the right track. However, if treatment is delayed, if the owner waits too long to seek help, or if the dog is already in really bad shape when it gets to the vet, severe shock, organ failure starting, maybe developing bleeding complications like DIC, then the prognosis becomes much more guarded to poor.
Then untreated.
Untreated, as we said, the mortality rate is devastatingly high, up to 90%.
Okay. But for dogs that do pull through with treatment, what about the future? Can they get it again?
That's another piece of good news. The understanding based on the sources is that dogs who recover from SPD develop a strong, likely lifelong immunity to the Neorickettsia Helminthoeca bacteria.
So they're protected.
It seems so. Recurrence in a dog that has previously recovered is considered very unlikely.
That's fantastic for those dogs and owners. Okay, let's bring us back to the listener. We've gone through what it is, how it works, how it's treated. Why is this important for someone listening, especially if they live in or travel to the Pacific Northwest with their dog?
Because prevention here is so important and achievable. Knowing this risk exists in that specific geographical area is the absolute first step.
What is the #1 thing someone can do to prevent their dog from getting salmon poisoning disease?
It's really quite simple, according to all the sources. Do not feed your dog any raw or undercooked salmon, trout, steelhead, or other freshwater fish from that Pacific Northwest endemic region. period.
No raw fish scraps, no raw fish treats.
Exactly. And be mindful of scavenging, too. Don't let them grab fish carcasses or waste near rivers or coastlines in that area.
What if someone wants to share fish with their dog? Is there a safe way?
Yes. Cook it thoroughly. Cooking the fish to an internal temperature of 145 degrees Fahrenheit, that's about 63 degrees Celsius, will kill both the fluke metacercariae and the Neorickettsia bacteria they carry, making it safe.
What about freezing? Does that work?
Freezing can also kill the fluke larvae. The sources suggest freezing solid at -4 degrees F, -20 degrees C for at least 7 days should do it. But cooking is generally highlighted as the most reliably safe method. Beyond avoiding raw fish, just general awareness if you're in that zone is key. Know the signs we talked about. Understand that if your dog gets sick like that after potential fish exposure, it's an emergency. Don't wait. Get to a vet immediately. Time is absolutely critical.
And maybe be careful with fish waste disposal if you're fishing yourself.
Good point. Responsible disposal of fish carcasses and entrails so dogs can't easily access them is also part of prevention.
This has been a really thorough deep dive. It paints such a clear picture of this very unique, very serious disease.
Yeah, it really does, doesn't it? It's just such a textbook example almost of how interconnected everything in an ecosystem can be. You need the right snail, only in certain streams, which allows the right fluke to develop, which infects the right fish, carrying this specific bacterium, which is then deadly, but only really to communities, and only if they eat the fish raw. Change any one of those links.
And the whole thing falls apart.
Right. Especially that final link, the dog eating the raw fish. That's the one we can most easily control.
It really makes you stop and think, doesn't it, about all these hidden connections and potential dangers lurking in places you might not expect. How a tiny snail in a specific corner of the world can ultimately dictate whether or not a dog faces a life-threatening illness. It's definitely a reminder to be aware and cautious, especially when we're enjoying those incredible Pacific Northwest landscapes with our dogs.